Welcome to the Deep Dive. Today we're diving into Parkinson's disease. We got some sources here, and our goal is to pull out the key insights on coping, exercise which is crucial, and, well, when imaging really becomes necessary. Think of this as your shortcut to getting up to speed on a complex topic. We found some surprising stuff in here.
Yeah, and it's so important because Parkinson's, it's not just the tremors or the movement issues people often think of first. The emotional side, the cognitive impact, it's huge and often kind of overlooked. What's great about these sources is they give a fuller picture, less about just listing symptoms, more about actionable steps for a better quality of life.
Okay, so you mentioned emotional impacts right off the bat. Let's start there. What are people actually doing that helps? These active strategies you mentioned.
Right, so the research is pretty clear. Patients who use what we call active coping strategies, they tend to have a better quality of life. And significantly fewer depressive symptoms compared to folks using more passive methods like denial or just avoidance.
Active coping.
Okay.
What does that look like in practice?
Well, it breaks down into two main kinds. First, there's problem-focused coping. That's about tackling the external stuff directly. So maybe modifying your home to make it safer, setting up a really structured exercise routine, or being super proactive about medication schedules, practical changes.
Okay, changing the environment or the routine makes sense. What's the other type?
That's emotion-focused coping. This is more about managing your internal response, your feelings about the situation. Think things like mindfulness practices, maybe seeking out professional counseling, or joining support groups.
Oh, okay.
And there's actually a specific study mentioned, a Brazilian one, that found people in Parkinson's support groups had significantly lower anxiety and depression scores, and their quality of life ratings were higher too.
Wow.
Yeah. So the real takeaway is you kind of need both. Integrating the problem focus and the emotion focused stuff builds resilience overall. It's not an either.
Right, it's like tackling it from the outside and the inside, building that mental and physical toolbox, like you said.
Okay.
That makes a lot of sense. Now, exercise, the sources were really strong on this. Not just important, but medicine. That's a powerful word choice. And I was genuinely surprised by that stat about forced rate cycling, pushing to 80-85% max heart rate, improving motor scores by up to 40%. That sounds huge.
It is huge. It really drives home why exercise isn't just, a good idea. It's therapeutic. And the guidelines they lay out are pretty specific. For aerobic stuff, they're talking 20 to 60 minutes, 3 to 5 days a week. Intensity should be moderate to high thing, brisk walking, cycling, that sort of thing. You're aiming for a specific heart rate range, like 40-60% of heart rate reserve, or even higher for high intensity.
Okay, so consistent aerobic work. What else?
Then there's resistance training. Building strength, that's recommended 2 or 3 times a week. We're talking 2 to 4 sets, maybe 8 to 15 reps, working at about 60-80% of your 1 rep max, basically. Lifting reasonably heavy.
Got it. Strength work too.
And don't forget flexibility and balance. Super important. 2 or 3 times a week for that as well. That includes stretching, both static and dynamic, and things like dual task balance drills, doing something else while balancing.
Okay, so it's a really well-rounded routine, cardio, strength, flexibility, balance.
Exactly. And the long-term view is key. Starting early and sticking with it, it seems it can actually slow the disease progression. It might even help reduce how much medication someone needs down the line. And of course, the mood boost is significant. It really is about investing in a better future, physically and mentally.
Okay, so lifestyle coping. These make a huge difference. But that brings up a fundamental question. How do doctors know for sure it is Parkinson's, especially early on, or if things look a bit unusual? When does imaging come into the picture?
That's a really important point because yes, the diagnosis is mostly clinical based on symptoms, history, neurological exam. But imaging, it becomes vital when things aren't clear-cut.
So what kind of scans are we talking about?
Well, one key tool is called a DaTscan. It's a specific type of SPECT scan. Its value is that it looks directly at the dopamine transporters in the brain. It can detect that loss of dopamine-producing cells with, honestly, incredible accuracy, like 98% sensitivity, similar specificity.
Yeah, 98%.
It's very reliable. And get this, it can actually lead to changing the diagnosis in about 1/3 of uncertain cases, and it influences the management plan in over half of those cases, so it has a real impact.
Okay, so DaTscan for confirming dopamine loss. What about MRI? People get MRIs for lots of things.
Right. An MRI in this context isn't usually to diagnose Parkinson's itself. Its main job is to rule out other conditions that might look similar. Things like small strokes or normal pressure hydrocephalus. It can also sometimes show patterns that suggest what we call atypical Parkinsonism conditions like MSA or PSP. You might see specific changes like atrophy in certain areas or characteristic signs like the hummingbird sign for PSP.
So MRI is more for ruling things out or spotting mimics.
Primarily, yes. Advanced MRI sequences are being researched, but they aren't standard clinical practice just yet for diagnosis.
So when would a doctor typically say, okay, let's get a scan? What are the triggers?
Good question. Usually, it's recommended when the diagnosis is genuinely uncertain. Maybe the tremor looks atypical, or the person has early sudden falls, or perhaps they're not responding well to standard Parkinson's medication like levodopa. That's often a red flag. Also, if the symptoms are progressing unusually quickly, a scan might be needed to check for other issues. And it's definitely used for surgical planning, like before deep brain stimulation, to confirm that underlying dopamine deficit is really there.
Right. Okay. This has been really clarifying. It really paints a picture of managing Parkinson's as this combination approach. You've got the psychological resilience from coping, the massive impact of consistent exercise, and then these very specific diagnostic tools used at the right moments.
Exactly. It's multifaceted. And maybe the final thought for you listening is this. It's not just about tackling one piece. The real power seems to come from integrating all of it, the mental resilience, the physical activity as medicine, and the smart use of diagnostics. Understanding how these pillars work together, that really empowers both patients and doctors to navigate Parkinson's with, more confidence and clarity, ultimately aiming for the best possible quality of life. It's about seeing the whole picture.